Welcome back to Smitty's Learning Room. Today we continue on with having a look at the classification of injuries. Last time we looked at soft tissue injuries, and this video is going to have a look at hard tissue injuries. And what are some of the common hard tissue injuries and how do we treat and manage them? So when we have a look at the syllabus, we know it still comes under this focus question, how are sports injuries classified and managed? And we come down to learn about the bullet point hard tissue injuries. So we're going to have a look at fractures and dislocations for that today, and we'll also have a look at ways to manage these injuries. So when we look at hard tissue injuries, these are injuries that affect the hard tissues in the body, for example, the bones and the teeth. Now, the main types of hard tissue injuries that occur in sport are fractures and dislocations. So we start by having a look at fractures. So here you can see that we've got three different types of fractures. We've got just a general fracture, which is usually identified by a clean break. So you can see here in the bone that the break's just gone straight through, it's relatively clean. The next type of fracture we have a look at is a compound fracture. Now, a compound fracture is where the bone has broken, but it's actually also broken the surface of the skin. And you'll know that this is a compound fracture by the fact you may actually see the bone sticking out of the skin, or there's a presence of blood at the site where the bone has actually broken. And finally, the third type of fracture, which is quite common amongst young athletes, is a green stick fracture. And this is, or there might be a hairline fracture, and this is just like a semi-break. So just a little crack in the bone. It hasn't gone all the way through, or it hasn't actually pierced the skin. So let's have a look at the management of fractures. What should we do? So we start by looking at applying first aid, so doctors A, B, C, D. Now we know what that is from the Year 11 preliminary course. We then want to try and control any bleeding if there is. So if we've got a compound fracture, we need to control the bleeding as best we can without causing any further damage or further pain to the athlete. Most of the times you'll probably have to treat the athlete for shock, especially if they heard the bone break or if they're a younger athlete and they're in quite a lot of pain. So that would just be putting the athlete in a comfortable position and to try and control their breathing. You would then need to try and immobilise the area. Now, when we talk about this concept of immobilisation, that just basically means stop the athlete from moving their body. So if they're able to just lie there relatively still and not move it, that's great. It may be a case where you need to apply a splint to that area. And then obviously you would seek immediate medical assistance in relation to this. So you would send someone to the hospital, or depending on the severity of the break, you may need to call for an ambulance to get them transported to the hospital. Now, how do we tell if someone's suffering from a fracture? Now, some signs and symptoms are that there will be an obvious deformity. If it's a complete fracture, it's gone through the whole bone. The limb may seem limp, but there will definitely be some form of deformity. It could be just a bump in the arm or the leg wherever it's broken. Obviously, if it's a compound fracture, it would be uncontrolled bleeding. So we've got bleeding that's coming from the skin because the bone's popped out. If we're not sure, like we don't initially identify it as a break, but the athlete can't complete toe taps, this is also another way that we know that it could be a fracture. Now, the concept of toe taps will be visited later on in the syllabus, and you'll be able to understand that a little bit further. So the second type of hard tissue injury is a dislocation. Now, a dislocation is basically when the bone has been displaced at a joint. So the bone is out of place at a joint. And that can come in two things. You have a full dislocation where the bone comes out of place and it stays out of place, or something else we call a subluxation, which is where the bone sort of pops out and then pops in. And this can be quite common for a knee or a shoulder or a hip or even a finger. So obviously, even though it's not a complete dislocation in that the bone is not out of place, the treatment for the subluxation is probably similar to what we should be using for a dislocation, and will still probably at times cause the same amount of pain. So let's have a look at the treatment of dislocation. So again, like the bones, a fracture, we look at the doctor's ABCD principle, and we try and immobilise the joint if we can. So don't try and get someone to move the joint because this can cause issues. What we want to try and do with the dislocation is to ice and elevate or support the joint. So if it's uncomfortable for the athlete to elevate their joint, we're obviously not going to elevate it, because we want the athlete to feel comfortable and supported, and try and put ice on that joint, because we would have had some sort of strain or sprain to the ligaments and tendons and muscles around that area. Obviously, you would need to seek immediate medical attention, whether that be a physio or a doctor, or even to casualty if it's been dislocated and it hasn't gone back in. One thing is that you should never try to attempt to relocate the bone, so put the bone back in place. You need to make sure that a medical practitioner is doing that. So some signs and symptoms of people suffering from a dislocation are that you'll see some deformity and swelling. So a little bit similar to a bone break, but you'll see some swelling in there as well. There'll be some pain and tenderness. Generally, the athlete will be able to say to you, it felt like my bone sort of came out of its joint, and they'll be in a lot of pain. And then obviously they'll have loss of function of that joint because they won't be able to move it properly. So in summary, we have a look at our hard tissue injuries, and we have fractures. So we've got just your general fracture, a compound fracture, which is where the fracture breaks the skin, or the bone breaks the skin, which can cause bleeding, and a green stick fracture or hairline fracture, where it's just a slight fracture into the bone. It doesn't necessarily go all the way through. Then we have dislocations, where we have a straight dislocation where the bone fully pops out of the joint, or then a subluxation where the bone pops out and then pops straight back in again.